Job well done. We already done with the bed bath, and now let's proceed to our next one. We have the sponge baths. So sponge bath naman tayo ngayon mga anak. So when we say sponge bath, that is use of wash basin filled with cool or tepid water to sponge the client in order to dissipate heat from the body through the conduction and vaporization. So what are the purpose of our sponge bath? Number one, syempre to reduce the elevated body temperature, and number two, to make the patients comfortable. So what are the equipment needed? Number one, we have the basin, washcloths, towel, bath towel, and then we have the gown. So yan yung mga necessary equipments that we need in our sponge bath. So let's proceed to the procedures needed to our client. So number one, we need also to determine the need of the clients, especially the equipments that needed. And then after that, we need also to wash our hands and gather all the necessary equipment that is needed. Siyempre, alam na natin, gas-gas na, sabi ko nga sa inyo, that is washing our hand is to prevent the spread of microorganisms. Okay, so after that, we identify the patients and explain the procedure. Syempre, to be able to obtain the client's cooperations. And then, we need also to take the client's temperature. So, in taking the client's temperature, that is to provide the baseline data. And then, fill the basin with water. So, sa pagpipill natin ng water into our basin, it should be appropriate temperature. Yung appropriate temperature natin, it should be 29.5 degrees Celsius to 32 degrees Celsius. So, after that one, to transfer heat through conductions. Okay? So, next one, we need also to drape the clients with bath blanket and roll the top sheet to the bottom of the bed. And after that, we need also to remove the patient's gowns, exposing only the areas to be bathed. So, bakit? To prevent shivering and also to provide privacy. And after that, we need to sponge the client's face and forehead with a plain water. Do not dry. So, in adding alcohol to the water can damage the eyes and has unpleasant smell. So, usually kasi nakasayanayan na natin minsan kapag nag-sponge bath tayo or nagpupunas tayo sa sarili, naglalagay tayo ng alcohol. But then, adding alcohol to the water can damage our eyes and also give unpleasant smell. And after which, we need to place cool, moist washcloths in the axilla and the groins to remove when they start to dry. So this one to promote the heat loss due to the conductions. And after that, we need to sponge and massage the body area in a rotation manner. So it starts with the neck, arms, legs, back, and then moisten them for several minutes but do not dry after sponging. So to promote heat loss, sponging of the chest and abdomen is often omitted because it can initiate shivering. Okay? And then we need also to reassess the client's body temperature and pulse after 30 minutes. So bakit natin kailangan assess yung ating body's temperature? So we need to assess the client's skin, the color, and the pulse during the procedure and assess the body temperature. So because overcooling can occur which will trigger further heat productions and conservation. So, kailangan natin i-reassess yung ating client's body temperatures after 30 minutes. And after which, we need to discontinue the bath when desired temperature is reached, usually lasting for 20 to 30 minutes. So, the intervention with heat no longer necessary. Okay? And after that, we need to pat the client dry and when bath is completed. So why? Because rubbing the skin surface creates frictions and heat. And after that, place the client in comfortable positions, put a clean gown on the patient. So, to promote patient's comfort and safety. And then, syempre, remove the equipments used and wash our hands to maintain cleanliness of the environment and to minimize the spread of the microorganisms. And let's proceed to the evaluations process. We need also again to reassess the body temperature. Sabi ko nga, we need to assess the skin color or the color or pulse during that procedure. So para overcooling can trigger further heat productions and conservations. And lastly, we need to document. So record the type of the procedure rendered and the body temperature and the clients into our clients. Okay, so that is for sponge bath.